Hey, good people, what's going on? Dr. Dan here. Just wanted to say hi on this lovely Tuesday morning. I think I sort of hesitated and waited a little too long to get this live video going. Full disclosure, guys, I'm going to have to run back and see patients very shortly here. But I did want to say hello to you good folks and sort of piggyback off of what we were talking about yesterday regarding PTSD. We were talking about the PTSD test and the 17 symptoms of PTSD. Morning, son of a king. Appreciate the support, man, always. I just wanted to dig into the PTSD a little bit further and really take a look at it because I don't think I was able to delve as much into it yesterday as I wanted to. Looking at it through the lens of the endocannabinoid deficiency, okay? That's really how we landed at the point where PTSD is a viable diagnosis for patients, at least in Arkansas, to get their medical marijuana card legally. So let's just take a look at this. The idea of the endocannabinoid deficiency was first pioneered by Ethan Russo, which, if you don't know the name, you know, this person, this scientist, he's an MD, PhD scientist, I believe. Huge pioneer, folks, in the medical cannabis arena in terms of research and really pushing forward a lot of the knowledge regarding the endocannabinoid system and a host of other things, including terpene interactions. He's delved a lot into that. Either way, when you look at PTSD as sort of a product of the endocannabinoid deficiency, it becomes clear real early on how and why using medicinal cannabis as a supplement in addressing this disorder, along with other adaptive techniques, learned techniques, practices apart from cannabis, when cannabis is used along with them, clearly there's a very direct interaction with the system that controls the neurohormonal interaction that causes the downfield pathology behind PTSD. So let's just dig into that a little bit. You know, I just want to touch on the endocannabinoid deficiency of it. I don't want to really delve too deeply into the clusters of the, you know, the symptoms today, you know, such as the avoidance and the self-blame and the negative reactions and the triggers behind PTSD. We'll save that probably for a later on talk later on in the week. But, you know, really, as far as the endocannabinoid deficiencies are concerned, remember, under the tenses of PTSD, you know, we talk about military flashbacks and military experience a whole lot, but remember, PTSD runs a full spectrum of different situations that can cause imprinting of a memory on the brain under the fight or flight situation, okay? The adrenaline situation. When we talk about adrenaline and epinephrine, these are the same thing. They're interchangeable, okay? And the sympathetic nervous system and fight or flight, all of these terms you'll probably hear me say repetitively, and they're all interchangeable, okay? So the fight or flight system, eek, lion, you know, adrenaline starts pumping, epinephrine, as it's called, you know, or norepinephrine, noradrenaline. You know, these are the things that'll hit the nerve terminal and get us to, you know, run away and save ourselves. Not a relaxing time, okay? What happens under a situation where someone is being assaulted, or if someone is being really verbally threatening or demeaning, it's gonna crush that vulnerable part of our emotional system, our limbic system, which resides in the ventromedial prefrontal cortex. I'll insert some sort of little cool thing, you know, illustration at some point when I can step up the editing game, but it's the ventromedial prefrontal cortex along with the amygdala where these memories get imprinted and tattooed under the sympathetic nervous system, under the control of adrenaline. And how what happens is the endocannabinoid system gets overexhausted with trying to catch up and wind it back and get the system to settle down. And that's how you move from having a post-traumatic stressor to having a post-traumatic stress disorder. The disorder happens when the endocannabinoid system can't make up for that deficiency, when you're having a memory imprinted under the sympathetic nervous system control. Okay, so the anandamide and 2-AG can't catch up and counterbalance it with the serotonin and dopamine to get someone cool like a cucumber. Okay, so that's where the endocannabinoid deficiency comes in. The insult and the degree of insult, or the adaptive process to extinguish the memory, is not enough because it was tattooed too hard to extinguish, as opposed to an innocuous stimulus. Say if you had a unsavory interaction with another driver on the road, and then you had a fight, but it was just too unimportant to remember, gets filed in the back. If you have a threatening parent or step parent, as I come to see a whole lot, and they do very abusive things, the degree of that insult is too much to extinguish, and the endocannabinoid system gets overrun. And that's how you get a lot of the aversive memories and people avoiding certain situations and having maladaptive behaviors, such as engaging in risky behaviors, those sorts of things. All right. Memory problems at some point, in some cases. So yeah, guys, I just wanted to outline that, it's an endocannabinoid deficiency. And that's for that reason, when we go by chasing it with traditional methods, using anti-anxiety medications, oftentimes benzodiazepines, which I talk about to some length, they come with their own degree of side effects, and we'll chime in with antidepressants, as far as the medications go. And if we get really behind, and sometimes we'll ratchet it up to antipsychotics, and they can come with their own set of side effects, like even elevated cholesterol levels, muscle rigidity, a host of other things that can happen with the antipsychotics, liver interactions, what have you, kidney interactions. So anyway, when we go that way, the modern medicine method, we don't always, oftentimes we end up with decremental returns. Okay, we hit a point where they're effective and then it drops off. And we don't get that with marijuana because it acts right at the source where we're having that endocannabinoid deficiency. And when we're able to do that and address it at the source, we're able to naturally get our serotonin and dopamine levels more in line, where we're able to handle that memory when it does come up. We're able to handle it and not turn on that fight or flight response that's associated with it. And that sort of conditioning only happens with repetition. And when we're able to engage the endocannabinoid system naturally and repetitively, and use it in the background of healthy, active practices, such as cognitive behavioral therapy, EMDR, which I'll get into at some other point. I don't want to dig into EMDR right now. It has to do with rapid eye movement, some sort of training. But things like yoga, stretching, that sort of stuff, when marijuana is combined with these adaptive practices that we have to be active with, people get good results. Anyway, I just wanted to open up that door for you guys, the endocannabinoid deficiency, so that you can explore it further, because it really forms the basis for how I go about treating, looking at things in the cannabis medicine arena. Things are going to be formed from pathology, is going to be formed oftentimes from an endocannabinoid deficiency, and being able to titrate the amount of deficit that we have to make up. That's where the clinical sort of interview and that thing comes in. Anyway, folks, thanks for tuning in. Been a pleasure. I'll get to my first patient, whom I'm late for. My apologies, mea culpa. Dr. Dan, guys, Air MMJ cards, over and out. Boom. Have a great day.